Welcome to HealthFirst Top Doctors podcast. Today we're discussing body contouring with Mr Guirgis Awad, highly experienced consultant plastic surgeon based in Sheffield, Rotherham and Birmingham. So how are you, Mr Awad?
I'm very well, thank you. How are you?
Great. Really well. Like I said before, looking forward to the weekends. Glad it's Friday.
Yeah, absolutely.
So, could you tell us a little bit more about yourself and your work?
Yeah, sure. I work as a full-time consultant plastic surgeon in Sheffield teaching hospitals. I lead the breast reconstruction services, helping ladies who pass through breast cancer, mastectomy, or reconstruction of the breast, especially by microsurgery or microscopic surgery, where we take tissue or flesh from one area and rebuild the breast with it through microscopic surgery. I also deal with significant amount of breast corrective surgeries for various reasons, whether it's developmental or secondary to injuries or trauma or surgeries whatsoever, which I find quite satisfying for me, and I've got a real passion for this. Besides that, in the private sector, I offer all sorts of cosmetic surgery and aesthetic surgeries.
Fantastic. Okay, so let's get started with the questions. So what is body contouring surgery, and why do people decide to go ahead with it?
Well, body contouring is part of plastic surgery, and I'm pretty sure many people know that plastic comes from a Greek word called plastikos, or plastica, which is to mold or reshape. And this applies to body contouring, really. So in body contouring, we work on improving the whole shape and contour of part of the body. And this entails adjustment of the skin envelope and adjustment of the content. So the skin envelope, usually in body contouring, there is excess skin. So we look at where this excess skin is and how to remove it in a cosmetic way so that the skin envelope is snug fit to the appropriate content. So the content is usually the fat. So we look at if there is excess fat in some area or the other, where we remove it, or if there is deficient area that needs more volume, and then we can top it up, whether with fat or implants. So this is the idea of body contouring, improving the shape and the contour of the body by adjustment of the skin envelope and by adjustment of the content, and obviously this has to be bespoke to each patient, each person, according to their needs and following the proper assessment. Yeah.
Brilliant. Amazing. So who is a good candidate for body contouring?
Well, so I like to, when it comes to patient selection, to categorize it into 4 categories, really, which is the person has to be physically healthy, medically fit, mentally fit, and socially fit. So I look into these 4 areas whenever I'm offering any surgery for the patient. So physically fit, the person has to be of good general fitness, with appropriate nutritional status, so they're not malnourished or so, non-smokers, because nicotine has got significant negative effect on wound healing and significantly increase the risk of wound healing and wound breakdown. So this poses a risk for patients who are undergoing big cuts and closures, as well as a reasonable BMI, which is the body mass index, indicating that it's a reasonable body weight and it's a stable body weight. So they have managed to achieve a healthier lifestyle, have managed to lose the excess weight, have managed to achieve a healthy BMI, body mass index for them, and they have managed to maintain it at this healthy level. And then now they are looking to improve the shape of the body. So this under the first category, which is physically healthy in my book. The second thing is they have to be medically fit. So they haven't got major heart or chest problems that can prevent them, or having a longer general anesthetic can pose a risk on them. So this wouldn't be a suitable procedure for them. Likewise, any sort of major kidney or liver problems that prevent them from having general anesthetic. And of relevance, two medical things I look at, basically, which is the blood sugar and any medical conditions that affect the wound healing. So the blood sugar means that they are not diabetics, or if they are diabetic, then the diabetes has to be well controlled over long term. So we look into a blood test to show us and to confirm that the diabetes has been controlled over the long term with various tests, various plus tests. Because again, poorly controlled diabetes significantly contributes to higher risk of wound healing problems and higher risk of infection and wound breakdown, which obviously we wouldn't accept this risk for patients who are undergoing such procedure. The other thing medically there are some what we call collagen diseases which affect the wound healing and significantly increase the risk of wound healing. In such case, perhaps we have to be extremely careful in offering cosmetic surgery for these patients. And again, this comes through the thorough assessment and evaluation of the patient in clinic. The third category is mentally fit. And this is very important point. I mean, the person who is pursuing cosmetic surgery, first of all, they have to have appropriate motivation for surgery. So this is something, as a plastic surgeon, I take time to evaluate and assess to ensure that the motivation for this surgery is a self-motivation for becoming the better version of me, or the best version of me. And if this is the case, I'll be delighted to help the person. But if the motivation is not a healthy motivation, in surgery for the sake of somebody else, somebody putting pressure, this is not the right motivation. So it's not mentally fit. And the other thing is, in mentally fit, is having appropriate expectations. And again, with time and experience, this is something that I really spend time with to ensure that the patients have the appropriate expectations. Because unfortunately, with the social media and what's on the social media and significant exposure to different pictures, some people come with unrealistic expectations to what could be achievable. And that's, again, this category of people, we have to spend time with them to explain to them what to expect and to ensure that they properly understand what to expect. For instance, I get some ladies coming for like mommy makeovers, so having significant droopiness, loss of volume of the breast, requiring something called breast augmentation and uplift or mastopexy. But then in their mindset, they want a picture of a very young lady wanting just breast implants. And I have to spend time to explain to them the difference in expectations. So I'm just giving you an example of unrealistic expectation. So yeah, we spoke about 3 points, which is physically fit, medically fit, and mentally fit. And the last thing is socially fit. And we shouldn't underestimate this point, because surgery has got implications. It's very important for me to ensure that the person has got is able or can afford having time off after surgery, and will have the proper family or friend support in the first few days after surgery. And in certain procedures, they are able and can afford not driving for a certain period after surgery. So all of these are things we have to take into consideration. Also, if they've got any specific social plans within the time frame of surgery, long travels, long haul flights, all of these things are things I chat to the patient about to ensure that it is suitable. So to summarize, the good candidate for surgery in general, cosmetic surgery, body contouring, they have to be physically healthy, medically fit, mentally fit, and socially fit. Of particular interest to the body contouring, this would be a person who successfully managed to achieve a healthier lifestyle, stable weight, and maintain this stable weight, and now in a healthy manner looking for improving self-image, self-confidence. And it usually comes after weight loss through healthier lifestyle or through the weight loss medications, or after being pregnant or so, with significant changes to the body where there is significant increase in volume and stretching of the skin, and then all of this is lost again, so the skin stretches, but then the person has managed to achieve again a stable and healthy lifestyle.
Fantastic. Thank you so much for that detailed explanation. And I think you're right. Some people might go in with unrealistic expectations, or not really having thought about exactly what they're going to be doing to their body. So, just to highlight that a responsible approach and a reciprocal relationship where the patient is fully informed, I think, it's just really useful to hear that, like I said, just explained in full detail. That's great.
Yeah.
Okay. So what are the different types of body contouring?
Well, that's a very good question. It depends which area of the body we're talking about. So it could be contouring of the tummy or trunk, the front of the trunk, and this could be something like different types of tummy tucks, which we can talk about, or just liposuction, adjustment of the contour, or liposuction and lipomodeling, which is taking fat from one area and adding it to another area. It could be contouring of the back, and the back, sometimes some people will have fat rolls at the upper back, like around the bra line or so, under the scapulum. And some people have excess fat of the lower back, whether it's fat rolls or excess fat of the lower back and perhaps drop of the gluteal region, where we can offer lower back lift or 360 or belt lipectomy, or something called gluteoplasty, which is improving the position of the back or the buttock in relation to the back. It could be contouring of the arm. Some people have got significantly excess skin of the arm, and we adjust the contour by adjusting the skin again, something called brachioplasty or arm reduction, as well as some liposuction. Sometimes, again, it depends on the person. Could be of the thigh, where there is excess skin of the upper thigh, and then we perform an upper thigh lift. And it could be the chest, which is for ladies, there will be loss of volume and significant droopiness, and then missing the shape that you would like for the breast, where we perform something called mastopexy, which is uplift, as well as augmentation, increasing the volume. This could be what we call auto augmentation, if they've got the appropriate volume but in the wrong position. using this volume or adding fat from somewhere else, or using implant augmentation. So these are the main areas we can offer body contouring. And as I mentioned, if you wish, we can talk about the different types of tummy tuck.
Yeah, absolutely. Yeah, no problem. Let's go for it.
Yeah, so for the tummy tuck, again, the tummy is one of the areas where people get either stubborn fat, which is despite leading a very healthy lifestyle and losing weight, exercising, there are areas of stubborn fat. But likewise, after losing weight, the excess skin, especially of the lower tummy, would not necessarily shrink back in some people. And particularly for quick weight loss over a shorter period, the skin struggles really with shrinking back. So this requires removing the excess skin and the resistant fat. It could be as small as liposuction, or perhaps the flanks or the areas of excess fat, if the skin quality is good and the envelope would be snug fit. Or it could be skin resection as small as removing the lower part of the tummy, where, especially in ladies who have been pregnant, but still maintaining a good shape of the tummy, except for the excess overhang of the skin below the belly button. Then we can just remove and tighten that skin below the belly button without mobilizing the belly button. In other cases, we need to reshape the whole tummy by performing a full tummy tuck, and particularly with weaker muscles, where we strengthen and repair the muscle to give a good shape, redrape the skin, reposition the belly button, and we always aim to keep the scars hidden in the underwear line so that the scar is as hidden as possible. But in the full tummy tuck, there will be another scar around the belly button. In some people with after significant weight loss, they have got significantly excess fat everywhere, and we need to correct the excess skin in the vertical as well as in the horizontal areas. So we might offer what's called fleur-de-lis tummy tuck, which is like the lily flower. So it will be like a vertical scar and then the horizontal scar at the bottom. And this is to adjust both the vertical and the skin excess. And sometimes we can offer just belt-thigh pectomy, which is a 360, which is the full tummy tuck, but also uplift of the back. And these are quite, all of these, I mean, the tummy body contouring procedures are one of the most common procedures I perform, and that makes significant difference to the people who have it.
Absolutely, I can imagine. So, well, you've spoken a little bit about, well, we've spoken in great detail about tummy tucks as well. So my question might allude to this. But can different parts of the body be operated on as part of a combination procedure?
Yeah, absolutely. It's not uncommon that we offer combinations. This is particularly applies for people who have very successfully managed to lose significant amount of weight and lead a healthy lifestyle, where there is significant excess in different areas of the body. But likewise, I mean, as we mentioned, after being pregnant and completing the family, which people term mommy makeover. I don't like necessarily putting certain terms or the Ozempic body whatsoever. It's regardless, and how I like to describe it as I see it, which is the excess skin following healthy lifestyle or post massive weight loss or post weight loss surgeries, corrective surgeries. Because actually, as a matter of fact, I mean, I had quite a few young ladies who have never been pregnant. They come and ask for a mommy makeover. They have never been a mom, but it's just the term, which is understandable. But the term includes a combination of procedures. Like in this particular case, we can do the tummy and the breast, where we perform the suitable type of tummy tuck along with the breast adjustment. Sometimes we offer, some ladies come to me who have had tummy tuck in the past, but now have got significant skin excess, and then sometimes I offer what's called reverse abdominoplasty or reverse tummy tuck, where I tighten the upper part of the tummy up and excise the excess skin along with the uplift of the breast to give a better shape. Sometimes you offer, as I mentioned, the belt lipectomy or 360 is a combination, which is the front and the back. Other combinations could be tummy tuck and arm lifts, or tummy tuck and various types of liposuction. I don't like combining tummy tuck with thigh lift. It's a bit too much, and that's why, I mean, yes, we can combine surgeries. It has to be, again, bespoke, following a thorough consultation with the person, and looking into everything: the general fitness, the areas, the prioritization, the long-term plan, and the safety of having this combination together. And if it's deemed to be safe, it could be offered. If not, then I talk to my patients about the prioritization and which step we take before the other, and the time frame of waiting between one procedure and the other.
Absolutely. Highlighting the responsible approach. Amazing. Okay, so well, is body contouring painful?
That's a very good question. Is surgery painful? Well, I mean, as you know, our pain thresholds are different. So and the term painful is a little bit of a gray zone. In general, I can share with you what my patients feel after surgery, the vast majority, which they feel quite comfortable. And the vast majority of my patients, they advise that, oh, it's much easier than what I expected. Oh, it's, I didn't expect to be that. I was expecting much worse. And there are a few reasons. So we do take measures to ensure that the patient is as comfortable as possible, such as combining local anesthesia along with the general anesthetic. So despite that the patients are asleep, we do put local anesthetic so that when they wake up, they feel as comfortable as possible. The most discomfort happens in the first couple of hours after waking up. And then with the oral painkillers, this controls the pain or the discomfort. The vast majority of the patients require painkillers for 2 to 3 days on regular basis to always get on top of the pain if there is any pain. But after that, they do not usually require routine or regular painkillers. The vast majority of the patients advise that it was not that painful, especially when it's a skin tightening procedure. After liposuction and lipomodeling, they do feel bruising from the areas where the liposuction or lipomodeling fat transfer has been transferred to. But again, it's usually 2 to 3 days of bruising, deep bruising, that tends to settle with time. So the answer is, in general, the level of pain from these procedures is quite low. And I say in general, because you will have the exception. The odd person who has got oversensitive, perhaps, nerve endings. Some people, even with the healing process, they complain of pain along the scars, significant pain. And I explained to them that this is the nerves regenerating or growing back. But in some people, it gives stimulus or stimuli to the brain, indicating that this is too painful for them. And that's why I keep a close eye on all my patients. If there is any person who develops something like that, it's something that sometimes in the medical term we call it complex regional pain syndrome, where there is pain which is far more than what you expect from the injury or the procedure or the surgery, and then we address this appropriately. But this is the very, very, very exception category, while the rest of the patients who have these surgeries are, in general, not in much pain. Also, some stuff that help with reducing the pain is the compression garments that we advise the patient to wear, because it reduces the swelling, keep the tissue together, along with the anti-inflammatory, the painkillers. It helps with reducing the pain.
Fantastic. That's good to know that there's support available, and also that the majority of patients recover quite quickly with less pain. Okay, and so the final question, how long do body contouring results last?
Again, another good question. It's not one size fits all. And this is what we have to appreciate with any surgical procedure or with anything related to us as human beings, because we are all different. If the person has got good skin quality, as in the elasticity of the skin is good, and they had already achieved a stable, healthy body weight, and then they had the procedure after achieving the stable body weight, and after having the procedure maintained this in a healthy lifestyle as they have been, without any further significant weight loss or weight gain and fluctuation of the weight, the results tend to last for a long time. It could last for good. And I'm very accurate, so you say it could, but it might not, depending on many factors, depending on the skin quality, depending on the fluctuation of the weight, and depending on what the person has, whether any other medical problems happen in the future. But in general, the results stay for a long time. You have to be careful about the results of the breast surgeries, because again, the results can stay long time, provided that it's well maintained, as in reducing the effect of gravity on the areas that are projecting, such as the breast, by wearing bra, supporting bra, because the more you're able to maintain the positioning and maintain the stable body weight, the longer the results could stay. But if any of these factors change or affected, the longevity of the results could vary from one person to the other.
Fantastic. Great answer. Okay, brilliant. Well, that's it for today. Thank you so much for joining us, Mr. Awad.
Thank you.
No problem. Okay, so if you're considering body contouring, arrange a consultation with Mr. Awad via his Top Doctors profile at topdoctors.co.uk.